Hello everyone, and welcome to this audio podcast. This audio podcast is part of the shitstorm chapter. This audio podcast is part of the analysis and expose in robotics. This audio podcast is part of the shitstorm motley. This audio podcast is part of the jump off. This audio podcast is part of the segment V2, and this audio podcast is part of a Storm Robotics production. In this audio podcast, a look at sort of smarter aspects in and around pertaining to smarter practicing in line to this collaborative works from 2019. So individuals living in individuals or residents in nursing and care home environs, especially older individuals, tend to require sort of specialist care and consideration from primary healthcare providers or primary healthcare providers or primary healthcare prescribers. This is reflected in also a document referred to as Medicines for Older People, a component document really in line to the National Service Framework for Older People, which was initially conceptualized by the Department of Health in around the early millennia. The document sort of describes how to maximize the advantages of medicines and how to avoid excessive or inappropriate or inadequate medicines used by individuals or for individuals in nursing and care home environs. So with respect to the elderly population, most important effect is reduced where there can be reduced kidney clearance or renal clearance. So older individuals excrete drugs more slowly, or wherein amongst evidence indicates that individuals in amongst the elderly population excrete drugs more slowly and are highly susceptible, can be susceptible to nephrotoxic drugs, drugs or treatment modalities. An individual stabilized on pharmacotherapeutics with a narrow therapeutic window, for example, treatments such as digoxin, being a particular treatment for aspects pertaining to ABP or arterial blood pressure, can rapidly develop adverse effects in the aftermath of particular symptomologies and additionally in around, for example, in around respiratory sort of conditions. The hepatic or the liver metabolism of particular drugs is also reduced, or is also reduced in this. The hepatic metabolism of particular drugs or treatment modalities is also reduced in the elderly cohorts because there is a reduction, or can be a reduction, in liver volume. Again, this is particularly important for treatment or drug modalities with a narrow in pharmacotherapeutics, or for pharmacotherapeutics with a narrow therapeutic window. That draws this audio podcast to a close. This audio podcast as part of the shitstorm chapter. This audio podcast as part of the analysis and expose in robotics. This audio podcast is part of the shitstorm motley. This audio podcast is part of the jump off and segment and V2 and a Storm Robotics production.